Hi and welcome to my channel. I am Dr. Kalyan, a consultant cardiologist. In today's video we will attempt to demystify what actually happens in real life during a heart attack. Imagine, Rahul and his wife are having a casual conversation after dinner. Suddenly Rahul experiences some chest discomfort. He feels chest tightness and starts sweating. His wife senses something is amiss. Luckily for her, she is aware of heart attacks. Rahul was already on heart medications. She gets 3 baby aspirins and asks Rahul to chew. She then calls 999, the emergency ambulance service. Rahul is rushed in an ambulance to the hospital. The hospital has already been notified of his coming and are ready to receive him in the emergency department, where he is connected to a monitor and an intravenous line inserted. Dr. Kalyan, the consultant cardiologist, comes and orders a blood troponin and a 12-lead ECG, also called an electrocardiogram. The ECG reveals a heart attack, called myocardial infarction in medical terminology. Heart attacks are caused due to blockage in the blood vessels supplying the heart, also known as the coronary arteries. Modern-day treatment entails opening up of the coronary arterial blockage by a procedure called coronary angioplasty or PCI, percutaneous coronary intervention. Rahul is rushed to the CATHLAB or the cardiac catheterization laboratory, where Dr. Kalyan first performs a coronary angiography. A coronary angiography is usually performed through the hands under local anesthesia. Rahul is completely awake during the procedure and there is minimal pain due to a small needle prick in the hands. A small catheter is introduced and dye or contrast is injected into the arteries of the heart to visualize the blockage. The procedure usually takes 5 to 10 minutes. Dr. Kalyan now is able to know that the main artery of the heart is blocked. He then performs a coronary angioplasty. He passes a wire to negotiate the blockage and then uses a balloon. The balloon is inflated to open up the artery and blood starts flowing again. He then places a coronary stent to keep the artery open. A stent is a metallic mesh coated with drugs which helps keep the artery open. Coronary angioplasty or PCI usually takes 20 to 30 minutes if uncomplicated. Rahul is now feeling much better and can be shifted to an coronary intensive care unit. Here, one can see that the main artery is completely blocked and no blood is flowing. Blood in the artery appears black on the coronary angiogram. A wire is then passed and some blood flow is restored. A coronary balloon is then taken to the blocked site and inflated. Now, a coronary stent is taken. It can be visualized between 2 black dots. It is inflated and proper blood flow is restored. The coronary artery is now completely open and blood flow has been restored. Patients are usually discharged in 2 to 3 days. One can resume activities of daily living immediately. Light to moderate exercise can be started in about a week. One should watch for any chest pain, breathing difficulty or any swelling or discharge at the local puncture site. One should also take 2 blood-thinning medications as advised by the cardiologist. Sex can be resumed once one is able to climb 2 flights of stairs without getting breathless. One should consume a low-fat diet, preferably after consulting a dietitian. One will compulsorily be on 2 blood-thinning medications for up to a year and also on lipid-lowering medications. The bad cholesterol or LDL target is 55 mg per deciliter. One should take other medications as advised.